Thank you. And thank you all of you for being here. Gout is a disease which I've been fascinated from years, because it's something that in rheumatology we can cure very few things. And actually, gout is one of those. You can have a full control if you do the right things from the beginning. So I'd just like to share information with you. Probably some of you have gout, and some of your relatives may have. So what is gout? And what you see in here is, that's what causes the gout. It's what they used to call uric acid. The better name is urate. The uric acid or urate gets into joints. And when it's in there, it causes all kinds of inflammatory responses and even joint damage, and that's what leads to the cause of the gout. So if you don't have uric acid in your joints, you don't have gout. But if it's there, then we can have a problem. So what is gout? How often is? And this is data from 2007, 2008. Now it's even a little higher. Gout is the most common inflammatory type of arthritis that we see. Way more common. If you see the circles, this is gout. There was 8.3 million. Now we're above 9. When I was training in Birmingham back in 1980, there was only 6 million. So keeps increasing. And if you look at other diseases, fibromyalgia, for instance, 5 million. Rheumatoid arthritis, 1.3 million. So this is way more common than anything else. So it's the
U.S.
in United States. Yes, sir.
For U.S.
U.S. Yes. This is national health information, so they go around collecting all this data. So yes, this is not the world. It's for us. So it's a very common disease. So what are those patients? Most of them are men. Older people are going to have more often than younger, but it can happen. I have seen people in the 20s with a really bad gout. And that's something that if you treat properly early, you can save a lot of problems. And also is seen on post-menopausal women. And that's something we didn't see in the past. We have a gynecologist, a retired gynecologist here in the audience, and I remember way back there, and probably your mothers, they all did it. The first day they had hot flashes after the menopause, what would you do? Give hormones, hormone replacement. Now that doesn't happen anymore because there is a risk for cancer in the breast, the uterine cancer. But hormones are good for the uric acid. It keeps low. So the moment that you hit the menopause and you lose your hormones, the urate starts going up. And by age 70, the chance of a lady to have gout is equal to any man. So it's one of the reasons why it increases. These people have a number of other comorbidities. Quite often, people with gout can have a hypertension, heart disease, high cholesterol, diabetes, combination of all of those, which is called metabolic syndrome. So those are people who have sometimes a number of problems and makes it a little more difficult to try to treat them, but they can be treated. Also happened that about 60%, you take 10, 6 people with gout have some degree of renal insufficiency, which makes it a little harder which drug you want to choose. So all of those has been, needs to be assessed. Why we get gout? Well, uric acid is increasing. We live longer than we did before. We take medications. Medication mainly fluid pills. That's for blood pressure. Hydrochlorothiazide. Some of you may be taking. That increases the uric acid and can predispose to gout. Aspirin, low-dose aspirin, baby aspirin, increases the uric acid. Way back when I was training in rheumatology, we didn't see rheumatoid arthritis and gout at the same time. They said it just doesn't happen. And we're wondering why. Back there, we did not have too many treatment options available. And for rheumatoid, we used to give a lot of aspirins. How many aspirins a day? 20, 22 aspirin a day. We had nothing else. Everybody had a bleeding ulcer. Everybody had ringing in the ears. I used to tell them, if the phone rings twice and there's nobody in there, stop answering the phone, decrease the aspirin, you'll get better. High dose of aspirin keeps the uric acid down, so they didn't get gout. But now you take only one a day, a baby aspirin, the uric acid goes up, and the chance of gout increases. But you have to do it. If you have to take aspirin, you have to. But it's something that can cause issues. That's why there are 9 million people with gout now versus 6 years ago. There are other drugs. Some of them we don't need to talk about, cyclosporine, but also nicotinic acid, that's a vitamin B, niacin, used for cholesterol, can increase the uric acid. And the levodopa, that's something used for Parkinson's disease. So there are a number of medications that can increase the uric acid, and there are other medications that can decrease the uric acid. Then there are changes in the lifestyle. Nowadays, it's more common to see people a little more obese. You know, we live longer, we eat better, and that's a risk for gout as well. With more seafood, meat, all of those can increase the chance of having gout. Alcohol. Of the alcohol, the worst one is the beer, because it has purine for gout. Beer is worse than hard liquor and worse than wine. Some of you may have read in the old books that in France, the wealthy people had gout. That was called the disease of the kings. And the reason why they did, they were drinking wine. And you know, we all do the same thing. If you buy something from somewhere else, it's better than what you make. At least that's what we think. So the French would buy the wine from Spain because it was more expensive and they had the money to buy that. But in Spain, they would add the preservative into wine, which give a little better sweet flavor, plus will not go bad too often. That was called lead. So these people are drinking wine with lead, and the lead will cause all kinds of kidney damage, and eventually you have the gout. The peasants in France, that they will make the wine stomping into grapes, make their own wine, that had no lead. They didn't have gout. So it was the lead that was causing the problem. So I tell people, if you drink unleaded wine, it's okay. You know, that will not make you sick, but the lead is the problem. Something else has changed is the fructose corn syrup. Many of the soft drinks they have corn syrup. It's called fructose. That increases the uric acid. So if you drink 10 of those soft cans a day, gout is going to happen eventually. Now, something else I want to clarify, if we look at the people who have elevated uric acid in the blood, this is a blood test, there are about 40 million, but only 9 get gout. So not everybody who has high uric acid in the blood is going to have gout. We don't make a diagnosis in that way. So don't ask me, okay, check my uric acid to see if I have gout. That's not the way that works, because you may have high uric acid but never have gout, as long as you live. Where does the uric acid come from? There is a substance, a compound called purine. Purine is present in a number of foods, and mainly meat, seafood, into fructose, into beer, but also we have purines in our body, in our metabolism. 2/3 of the purines come from our own metabolism. 1/3 come from outside. And that's something that we need to remember, because it has to do with treatment. So that purine is transformed on something called hypoxanthine. We don't need to remember all those names. Hypoxanthine, eventually xanthine, and uric acid. And for us, humans, the line stops here. For other mammals, see, if you think about dogs, probably they eat meat all the time, and they don't get gout, because they have an enzyme in their system called uricase. Uricase breaks down the uric acid on something else called allantoin, which goes out to the kidneys. Way, way, way back, our ancestors, I'm talking about millions of years ago, we used to have uricase, and people would not get gout. But we needed to have a higher level of uric acid. Uric acid is an antioxidant. And back there, humans didn't have anything that were antioxidant, so there was a mutation. They stopped producing that uricase, but now we have changed our lifestyle. We eat a lot of things we shouldn't, and the uricase is not there anymore to break down that uric acid. So the purines, 1/3 comes from your food, 2/3 from your own metabolism. And that is there, not much you can do about it. So why the uric acid goes up? Well, every day, all of us, we make some, and some goes out through the kidneys. So there's a balance. How much you put in, how much you put out. If that's balanced, well, your numbers are normal. If you make too much, or you do not eliminate it enough, the number is going to increase. Just like if you look at your saving account, how much you have in there, it depends how much you put in, how much you take out. So if you do both, it goes very low. If you don't remove enough, so the same thing happened with the uric acid. Majority of the cases, 80% or 90%, is because we do not eliminate enough through the kidneys. In some cases, it happens because that's how you were born, and sometimes that's the primary hyperuricemia, and secondary, as we get older and our kidney doesn't filter as good as it should, or we take other medication that can affect the kidneys, then you cannot eliminate enough, and the numbers start going up, and you end up having gout. Only 10% is because they are overproducer. So what we do with these people, and how does it work, and that's something that people don't understand, even some physicians. Gout. Why you have gout? You have uric acid inside of the joints, and the presence of that uric acid, or urate is the proper name, causes an inflammation. So normally we have all those crystals, uric acid, that they are covered with a coating, with a protein, and your body, your immune system doesn't see them. If you happen to have a big dinner, eat a lot of shrimp, a lot of steak, a lot of beer, because you get dehydrated, or many other reasons, when the blood level goes up and down, then there are some cells inside of the joints called macrophages. They see the uric acid, and they phagocyte, that means they swallow that uric acid, and that triggers an inflammatory response. And you have a painful joint, a red joint, and eventually that may go away. So the fact that you don't have a flare, if you have gout, it doesn't mean you're out of the wood. The uric acid is there, and it's still causing damage even without you realizing. So that's why we need to treat all the time somebody with gout, and not just when you have a flare. That's something wrong to do. You can do it, but then the joints may get damaged. So we want to get rid of all those crystals. If they are not in the joint, you don't have gout. Gout is gone. And they have several patients. They have been treated now for 11, 12 years, never had gout again. And I tell them, as long as you keep taking your medication, you'll be gout-free for the rest of your life. The way that starts, anybody who's going to have gout, that 9 million people for whatever reason, at some point in life, it could be even as a teenager, you have elevated uric acid. This is called hyperuricemia, but you have no pain. The uric acid keeps going to the joints, deposited in other places, but you don't feel anything. One day, out of the blue, for whatever reason, you have a swollen, painful joint. Half of the time it may be the big toe, but it can happen anywhere else. It can happen in the wrist, in the elbows, in the knees. One time I saw somebody had it in the spine. It was very hard to figure out that, but it was in the spine. It was gout, which is very rare, but that can happen. Anyway, you have a flare, and that's going to last for 3 or 4 days, and goes away, even if you do nothing. It hurts like crazy, you cannot walk, you are in bed, even the covers may hurt you, but it goes away. And then you don't have anything else for a year, for 2 years. And one day, you have another flare, the second one. And then you have the third, and the fourth. And as time goes by, the frequency between flares becomes shorter. It was every 2 years, now it's once a year, now it's every 6 months, now it's once a month. So it becomes shorter and shorter, the period of pain-free, and the duration of the flare lasts longer. Before it was only 3 days, now it lasts the whole week, or even 2 weeks. And comes to the point, see, this is the pain level. Now look, it's still going up. So it comes to the point that you may be hurting continuously every day, but every month you may have a flare where the pain is much worse. That's what happened. So I think we need to, the first flare or the second flare, depending how high is your blood test, we should start some treatment then. Don't wait until things are too late. And why to wait? And somebody was asked me, said, well, why? I'm doing fine. I don't need any treatment. I don't like to take medication. All the excuses that we can make. So I said, okay, well, you're right. You know, you don't need to do anything. You know, the next time you see in your window, you see some termites, don't do anything, just wait to see what happens. See, in a year, what's going to happen? Your window is gone. Yes, you can replace that, but you cannot replace your joints. Okay? So that's like termites in your joints. So you need to get rid of them. That's how it shows. See, this is the, one of the first flares. It can happen in the first toe, very commonly. In this case, also in the ankle. You can see a lot of red, swelling, tenderness, and that can happen just overnight. I was telling my friend here, we had somebody who went to Ruth Chris to have a nice dinner, and he walked in, sat into the thing, had a big steak, drank, I don't know if it was beer or wine. He couldn't get up. When he was trying to go home, he said, what happened? His foot was so painful, they had to get him out in a wheelchair. A flare happened just over there, and he didn't even realize until he put a weight over his foot. So it can happen very, very quickly. That's going to go away, but it keeps coming. See, in this case, this lady, she has some enlarged knuckles in here, or joints. That's osteoarthritis. But on top of the osteoarthritis, there is gout. This redness that you can see in here, and I don't know if you can see from back there, see those white specks in there, can you see? Mm-hmm. That's uric acid. It looks like a toothpaste. Colgate, the white one, not Crest. I mean, that cannot be blue-red. That would be bad. Totally white, but has the thickness. It just looks just like a toothpaste, and it's there. So those are called tophi. Those are deposits of uric acid, urate, into joints and outside of the joints. Those are the tophi. When you see that, I mean, that should have never happened. You should treat way before you reach that stage. But if it happens, you still need to do something about it. Quite often, can get into elbow. That's not in the joint, it's in the bursa. We have bursas, and some people ask me, what's the difference between bursitis and arthritis? Bursa in Latin means bag. I'm Italian. If you go to Italy, ask for a bursa, they'll give you a bag. That's the name of that. So those are little bags that they are everywhere in your body where the muscles attach to the bone. It's just like a little cushion for protection outside of the joints. And there is a muscle here in the arm, the trapezius, which the triceps, sorry, attaches in the elbow. There's a bursa in there. That bursa can get swollen, can be painful, and in gout happen quite commonly. It's very easy to diagnose that. I just put and that's not a very sensitive area. You stick a small needle in there, pull some fluid out, look with a spatial microscope called polarized microscope, and you see the crystals. And you know that that's gout. And you know how to treat them from on. In this case, we see another tophi. Can you see there the white spot? This is a deposit of uric acid. And it happened with one of my patients. She is a female, and she was doing fine for a long time, has rheumatoid arthritis. Suddenly, the medication for rheumatoid arthritis are not working anymore. He said, well, doctor, I was fine, but now I'm hurting way more. And one day, so those things, he said, well, now you have gout. So that's a different thing. So the drug for rheumatoid will not do anything for the gout. So I had to treat her in a different way. So she has now two problems, the gout and the rheumatoid. And she's at the age where that can happen. And you can see those deposits, and after treating her for about 6 months, a year, all that white stuff is gone, because they will go away if you get the numbers where it should go. Quite often, those things happen in the ears. You see those white things in there? That's tophi. Not gout. Gout is inflammation of the joint. But tophi, those are deposits of urate. And usually happen in the coldest place of the body. Ear is much colder than a hip. So you can see tophi in the ears, see them in the elbows. Can you see them in the hands? And very easy to diagnose as well. You just take a small needle, just lance one of them, squeeze out a bit of that toothpaste, look at the microscope, okay, this is gout. And then we know what's wrong with you and how we should treat you from now on. But if you don't do anything, those tophi keep growing. And you can see here, you know, there's a big one in here, there. Those are all deposits of urate that can happen under the joint. Usually they're not very painful because it's not a joint. But they can be destructive. They can damage the bones. Like that. I mean, why would anybody let go like this? But it happens. About 5 years ago, there was a lady that she had gout, and she has been treated only twice in her life with some anti-inflammatory just for a week, but she didn't have too much pain. Also, she has some diabetes, and she went to see a surgeon, friend of mine who do wound care, and they had to amputate her toe because it was so badly damaged, and then the second toe had to be amputated as well. That could have been prevented if you do the proper treatment. You wait, the things are going to keep growing. Why would somebody don't get treatment is beyond me, but those things could be huge. Sometimes can be in the toes. This is the drainage as well. This is very red. That looks like an infection, right? He said. And another case, I have this lady who keep having infection on her foot, and she was admitted in the hospital for antibiotic. And in about 5 days, 6 days, the infection was gone. It means antibiotics are working. And then 3 months later, she had another infection. And the same story said, those are not infections, those are flares of gout. And the reason why I get better, not because the antibiotic is doing any good, it's just because gout goes away by itself. So start treatment for gout, and she didn't have any more infections in her feet. And she didn't have to be admitted in the hospital anymore. So sometimes it's confusing. They look like an infection, but they are not. So it's something that we will need to, and the way I found, I did, when she had a flare, I was able to put a needle in that joint, pull some fluid out. He said, this is gout. And started treatment, and she never had problems again. And that's what you see. That's how the uric acid or urate looks like. This is in a regular microscope. That's in a special microscope called polarized. All to one, they look like needles. Somebody asked me, oh, is that why the joint hurts so bad? Because I have needles in the joints? You say, yeah, it's not. It's because you have inflammation. But they look like needles. All to one in that direction, they're yellow. The other one are blue. That's called polarized microscope. But that's how they look like. So it's very easy to recognize those things inside of the joint. How we diagnose gout? And this is from the American College of Rheumatology. They came with the guidelines. Bottom line is, if I think you have gout, and if I see that you have the crystals of urate in the joint, or you have the tophus, you have gout. If I don't have that information, if let's say I don't have a microscope, or today I see you don't have the swollen joint that I can check, and you don't have the tophus, then you have to have 6 out of these 12 parameters. I'm not going to look at each one of those. There is no need for. But one of them is, the number 9, is the elevated uric acid. So if you only have hyperuricemia, which means a high uric acid, you only have 1. You need to have 6 to make a diagnosis of gout, unless you have a swollen joint where I can see those crystals, or if you have tophus, which we can recognize also that they are part of the gout. But the blood test by itself is not enough. Another thing that's important, and many don't realize of this, is if somebody has a gout and they check you and you have a blood level, whatever level, anything above 6 in somebody with gout is high. The reason, because that's the solubility. Above 6, the uric acid is not soluble and started depositing into joints and they deposit into soft tissues. So we want to keep the blood level below 6. So let's say your blood level is 9. The day that you have a flare and you go to emergency room, or you go to urgent care, or you go to your primary care and they do a blood test, when you have inflammation going on, that blood level drops. You had 9, now it's 7, which may be in the normal range. You wait 2 weeks, and the blood level goes up to 9. So if you only do a blood test, every time you have a flare, you're always low. Because there's inflammation. It's not an accurate result. And if I do your blood test while you have a flare and your blood level is 7, and I start you in a treatment and check back in a month, and now it's 8, oh, it's going up instead of coming down. No, maybe it was 9 or 10 to start with, and now has dropped to 8. You see what I point? So doing blood tests while you have a flare is not very helpful. You can do it, but it's not so accurate. So I like to do a blood test when you feel all right, when you're not having a flare. That'll give me a better idea. It's just like if you check your blood sugar after eating a big piece of pie, it's going to be high because of the whatever you ate. Same happening here. So how we manage gout? Now that we know what it is, how you have it, there are 3 stages in the treatment of gout. Everybody will tell them, yes, you have to watch your diet, change your lifestyle, eat less meat, less seafood, less beer, lose some weight, don't drink so many soft drinks which have the corn syrup. But by doing all of this, remember I told you at the beginning that the purines that come from outside is just 1/3. So you can drop the point, the urate level about 1 milligram. The rest come from inside. So if your blood level is 10, and I want to get you below 6, and you get in a good diet, from 10 you drop to 9, or from 9 you drop to 8, is that good enough? No, we are not resolving anything. And people need to understand the goal is keep your blood level below 6, otherwise we are failing. Yes, diet helps. If you can drop from 9 to 8, well, then medication can help you going further. If I'll give you a medication and you had a 12 to start with, and now we are down to 7, well, get in a diet. Now we are going to be below 6, just because you are working with your diet as well. So both are okay, but diet alone is not enough. And several people have told me, he said, oh, doctor, I'll manage. I don't want to take any pills. I'm going to get in a good diet. I will control my gout. He said, it's not going to happen. You think it will happen, but it's not. So we are failing there. Don't do that. You may lose your joints if we do it in the right way. So people need to understand what are we trying to accomplish when we decide that we want to treat you. So medications. There are 3 phases of the gout, as I mentioned before. 1, you have a flare. Your knee, your ankle, your toe is very painful, is red, swollen. What do? I have 3 options, and those are anti-inflammatory drugs, the NSAID. That includes all those drugs, ibuprofen, Aleve, Celebrex, indomethacin, whichever. They all work about the same. They can cause issues with interact with aspirin. They may have a problem if somebody has an ulcer, somebody has a kidney disease. So I choose, the doctor should choose which of these medication wants to give to a particular patient. And what I give to you may be different than what I suggest for you, depending on the overall health status. I can use corticosteroids. I can use colchicine. So all 3 of them, there is an injection, but that's not even approved, and it's very expensive. It costs like $4,000 per month. Insurance is not going to pay for that, but it works as well. So we have the 3 options. So either you're going to take an anti-inflammatory drug, you're going to take colchicine, or you take prednisone, cortisone. Once the flare is gone, then we go to phase number 2. So how do they work? Like a colchicine. You guys are familiar with the colchicine? Have you heard about that? Colchicine has been around for 5,000 years. The way it works, remember what we said before. In the joint, you have the crystals of urate, and they are phagocyted or swallowed by this macrophage, and that triggers the inflammation. What the colchicine does prevents that this green cell can gobble the urate. And if that doesn't happen, well, you don't have a flare. But you have to give that early, the first day, the first twinge of pain. If you wait 3 or 4 days, it's too late. all this inflammatory substance, all these things you see here, they're already in the joint. So now you're going to close the door so no more uric acid goes in. It's too late. The whole thing is there. It's just like if you have a napkin on fire and you have a glass of water, well, you can throw over that and you extinguish the fire. If the whole building is on fire and you have a glass of water, what do you do with that? Drink and run away, you know. So, but it's not going to help. So I tell my patient who already have gout to have that medication with them handy all the time, and at the first twinge of pain, take one. Don't call me. By the time you call me, maybe you have a flare. So take one pill right now. If you're fine in a couple of days, then you can back off. There's somebody, one of my patients, he went to, he liked to play golf. He went to Scotland and that famous golf course, and he did not take his colchicine. And the first day he had a flare of gout. He could not play golf at all for the whole week. What a wasting of his vacation. So he was miserable just with his foot up watching the other people playing. But he couldn't do it. So it should be given at the first dosage. And the way that we give colchicine is 2 pills at once, right now, and 1 hour later. That's it. Tomorrow you may have to take another 2 pills. But way back, and the way they used to do is you take 1 pill every hour until the gout goes away or you have side effects. And the main side effect was diarrhea or vomiting. Anybody has heard that thing before? Yeah, remember that? So I'll tell people, don't do it. You know, if you have a flare of gout, and you get usually the gout will not go away, diarrhea will come first. And if your foot is hurting and you get diarrhea, you may have a problem. You know, people will hate you forever. So don't do that. You take 2 pills now, 1 hour later. And usually I tell them to stay taking 1 pill every day until they come back to see me in about 2 or 3 weeks, when I'm going to do a blood test and decide what is the next step. Now, there is some contraindication with some other medications. If you are taking Ranexa, that's for the heart, you probably should not be taking colchicine, because there is a lot of interaction over there. But the doctor should be able to tell you which one you can take or not. But for many people, colchicine is a good drug. The second step is, now that your flare is gone, you come back to see me in 2 weeks. Your blood level is 9. So I need to get that blood level down. And the goal is to go below 6. 6 is okay, 5 is better, 4 is even better. So most of my patients are between 4 and 5. That's how I like to keep them. And they do fine that way. So I'm going to give you something to lower that blood test, but something is going to happen. And that's something that many people don't understand either. A flare of gout is one thing, and the blood level of uric acid, urate, is a different thing. Whenever we try to decrease the levels of uric acid, there are 2 drugs, mainly allopurinol or Uric, febuxostat. Anytime you mobilize the urate, you can have a flare. So I need to give you something to prevent flares. Otherwise, you start taking allopurinol, you say, well, doctor, that makes my gout worse. Yes, it will. So you need to take either colchicine or anti-inflammatory drug, or sometimes I use a prednisone for at least 6 months to prevent flares. And then we go with the phase number 3. And this is why 6 months. This is one of the studies we did back there. If you see in the patient in orange, those are the ones that were given no prophylaxis. They given placebo. The number of flares was way much higher than patients who were taking the medication. And we did the studies. You know, if but I'm going to show you something first and then summarize the whole thing. This is the 3rd phase, where we want to lower the uric acid. And we accomplish that with mainly two medications, which is either allopurinol, febuxostat. There are other drugs that may lower decrease the elimination through the kidneys. But how we'll do this? So I'm going to summarize this. You have a flare. I'm going to give you either a prednisone, colchicine, or anti-inflammatory drug. And keep taking until you come back to see me, which will be in about 2 weeks. Now you come back. How you doing? Fine. Flare is gone. I'm feeling really good. Let me check your blood level. It's 9. We need to lower that blood test. How we do that? I can use either allopurinol or I can use a febuxostat, Uric. Allopurinol or Uric. They are both effective. I'll show you which one is more effective, but they are both effective. They work in the same mechanism. Allopurinol is much cheaper than Uric. So whichever you're going to be taking, as soon as you start dropping the uric acid, it's likely that you're going to have flares. So I need to give you something to prevent those flares. And that will be either colchicine or anti-inflammatory drugs. And if it's colchicine, you take one every day. For how long? 6 months. If you do less than that, it's likely you have flares. We didn't study like that. In the first 2 months, we gave prophylaxis. People did very well. Then we stopped the medication, and they start having flares right and left. You give for the whole 6 months, you do much better. After 6 months, then it's very unlikely, or you still can have flares, but not so common, and then you will take the medication just as needed if you go there. But you need to stay on the allopurinol or Uric until we can get the blood level below 6. And the dosage, I need to adjust to accomplish that. So the first few months, I'm going to see you every month. I'm going to check your blood test every month to be sure that the blood test is where it should be. You have not flares for 3 months and your blood level are fine. Okay, come back in 3 months. You are doing okay. I'll see you back in 6 months. Many people, they come once a year. I check their blood test, still 3.5, 4, 4.5, taking the allopurinol or Uric. Have you taken any colchicine? No, I have them handy, but I have not taken one in a year because I have not had any flare. How long you keep taking allopurinol or any of those drugs? Forever. You stop, blood levels are going up again, and you start all over again. So when you have the gout control, stay on the allopurinol or stay on Uric. Which one we choose? Well, it depends on each person. You know, it's, if we compare and why we should decrease the uric acid. See, this is one study they did in Japan. If somebody has a blood level of 10, that's the urate level, your chance of having another flare is 100%. If you can drop that blood level down to 5, your chance of having a flare is about 3%. See that? So if you have a blood level of 10, I'm not going to wait that you keep having flares one after the other. Let's go to treat you now. As soon as we get your blood level control, then your flares will be gone. And those are the two drugs I was telling you about. This is the Uric and the allopurinol. Both work in the same. You remember that the purine I was showing you before, the purine becomes a xanthine and then a uric acid. There is an enzyme there, something that breaks down the purine. It's called xanthine oxidase. Both of them block that same thing. But there is some difference between the way that the medication behaves, but the endpoint is the same. And in one of the studies we did, I was involved with 3 of these trials, it showed that if you, in the blue, is the patient taking Uric 80 milligrams, 70% improve, get the blood level where we want. With allopurinol, about 40%. So if you use allopurinol with a lower dosage, 60% of the patients will not be on target. 60%, that's very high. So that's why we need to monitor your blood test, and we need to adjust the medication properly to get it to one that does the job for you. And everybody's different. You may do very well with 40, you may do very well with 80, somebody needs more than that. And sometimes is not enough, and in that case we may have to add other medication. This is the allopurinol. Yes, we start in a low dosage and gradually increase. If you have renal failure, we have to be careful. And there are some patients, mainly patients like from Korea, and some Chinese, and some black people, have this blood test. It's an HLA-B5801. Those are more likely to have bad reactions to allopurinol. So if I'm going to treat some Korean, I want to be sure that there is no family history of this, because I'd rather use something else that will not cause toxicity. But that's just the doctor deciding what to do. That's something you don't need to remember. Sometimes those medication is not enough. I mean, if you're taking allopurinol 300 or 600 milligrams a day, or you're taking Uric, and your blood level is still 7 or still 7.5, what we do? Well, watch your diet. Maybe by getting more strict in your diet, we can get you there. Or take vitamin C. Taking vitamin C every day helps eliminating the uric acid. So take a vitamin C every day. Dairy products help. But maybe I need to give another medication, which is called uricosuric, something that helps eliminating. In the kidneys, we have something called Urate 1. That's the Urate transporter. It's a transporter. It's something that moves the uric acid back and forth and tends to eliminate it through the kidneys. So sometimes we can add this medication to these other drugs to try to get your blood level down. In my experience, in my patients, majority of them I have been able to control with either allopurinol or Uric, getting the right dosage. Just 1 or 2 persons have needed to take this, which is given in combination. So those are drugs that will be decided by the physician, and we talk to you and explain why I think this will be a best option for you, or another one. And so those are the medication we were talking about. There is one, it's called Zurampic. Maybe you have heard about that or not, but they are uricosuric. And this is a tophus. This is the uric acid that we see in the crystals. So to summarize, again, gout is a very common disease. It's caused by the presence of uric acid in the joints. The treatment is, if you have a flare, we get rid of the flare. Then we will give you something to prevent further flares. That's called prophylaxis. And then we start you on something to lower the uric acid, which could be allopurinol or could be Uric. We discuss with you which one we want to use. Some of them are more expensive than others, and that could be an issue. Some are more effective than the others. There's contraindication with the kidneys. So those are always discussed one-on-one. Prophylaxis, you do for at least 6 months, and then just take as needed, colchicine, anti-inflammatory or corticosteroids. And when you get your blood level around 4, 5, or less than 6, you stay in the drug for the rest of your life. There has been some evidence lately that people who are taking allopurinol, actually they have better kidney function and fewer heart problems as well. So nephrologists like to, it's not approved for that, and we are not using to help heart or kidneys, but the studies are going in that direction, and may well be that in the near future they will be used in more frequently for other conditions besides gout. That's all. Any questions? Yes, sir.
What is your experience with the familial hereditary disposition in terms of family members?
There is a genetic predisposition, yes. And I ask somebody, well, anybody else in your family had gout? Oh yes, my brother and my uncle. Okay, well, let's get to see how's your blood test. Even though you may not have the symptoms, and if you have elevated uric acid, maybe I want to x-ray your hands and feet to see that there is no damage that you may have not been aware of. I always look at to see if you have those tophi. I would not start you a treatment just because your father had gout and because the uric acid, instead of being 6 for you, you have 8. Because you have not had a gout flare or a gout. You may never have as long as you live. So I don't want to commit you to take a medication for the rest of your life for something that you may never have. So that's why I want to have a diagnosis first. Yes?
How would you recommend treating someone in the ER having an acute flare who's already on a maintenance glucocorticoid and, let's say, an allopurinol and probenecid, and they come in with an active acute flare?
Yeah, if somebody's been treated, is taking allopurinol or is taking Uric, I don't stop that.
Right.
So you just use something to get rid of the inflammation. If that person is taking prednisone, 5 milligrams a day, well, give 80. So give a high dosage. If somebody is taking colchicine 1 a day, if the flare is just happening right now, you could go up to 2 pills and then 1 hour later. But in somebody has had flares for several days, then the best way will be going with a higher dose of corticosteroids, a Medrol dose pack, and start that and taper in several days. If you cut down very quickly, the flare is going to come back. You want to get rid of all those inflammatory substances in the joints, which is going to take a couple of days. So you cannot just do a treatment today and then, if it's just one swollen joint, let's say just a knee, I can drain that knee, remove all the fluid and inject cortisone inside of the joint. That will work as well.
Thank you.
You said there, as you age, it increases the chances of you getting gout.
Yes.
Is there a median age of when that may start occurring, or a typical age range for when it starts?
Okay, if you, did you all hear the question? Yeah, it's I mean, age. For a woman, it's menopause, when you lose your hormones. So that may vary. You know, some may be a little earlier, a little later. Not everybody will have. So probably you're going to have some genetic predisposition to have gout. Plus, you lose your hormones. And then goes also with a lifestyle. How much purines are you eating? And you may be eating way more than I do. I may not eat shrimp at all because I'm allergic to, but you can. And I don't like to drink beer. But my friend may drink a case of beer every week or every day. So in that case, it's not just age, it's everything else around it. Yeah?
You mentioned this. I mean, if you have 2 people, both have the same level of uric acid, and one gets farms crystals and the other one doesn't farm crystals. And so you can have hyperuricemia without gout, and then you can have it with gout.
Right.
What's the $64,000 question? Why does that happen?
Good question. I don't know. Probably something genetics, but why somebody's going to develop, or I think it has to do with genetics, but we don't have a pinpoint of what's doing that. But that's a $1 million question. Everybody said, why? Just happened. I don't know. Lucky that the one doesn't have it. Yes?
Is there any correlation between like allergy symptoms and gout? Because someone like me, I'm young. I think I'm showing symptoms of this. That's why I'm here. I've been allergic to corn most of my life. I can't eat shellfish. A lot of the same things that you're listing on there I can't eat. Is there a correlation, or is it possible that these allergy flare-ups that I think are happening are just a response?
No, I don't know. There's no real evidence of one way or the other. We don't know about many people with gout have other conditions, hypertension, diabetes, but it's not necessary that one causes the other one. I mean, why you will develop gout or not. Why you do and your brother doesn't? That's a good question. But no, there is not a risk factor that has been identified, not to my knowledge, that can say, okay, these people is more likely to develop gout because of these things. Well, thank you very much. Yeah.
South's location is awesome because it's only about 30 miles or so from the beach, so it's really not hard to make a quick weekend getaway. I love Mobtown because I feel like I always find something new every time I go downtown, whether it's Mardi Gras or I'm just enjoying great food on a spring evening. South's campus has a really awesome atmosphere because of how open it is. It really invites some of our natural surroundings that are so inherent to Alabama to be part of our campus life.
When I visited South's campus, I loved everything about it, especially the faculty. I think that was the biggest thing because everybody was so friendly. I think what makes South special is a very student-centered atmosphere. Is that when you arrive on campus, you already feel like a part of the community.
When I applied to South, I was really pleased to see that I was in a university that offered me so many different opportunities, and that's what really made me feel like I was in the right place.
With all the scholarships on campus, the freshman leadership scholarships, they're in classes together. You know, you have a really close group of people that you know as soon as you get on campus. There are also tons of other opportunities for different majors, pre-health majors. Anything that you're passionate about, you can come to campus and probably find something where you can get rewarded for that passion.
Being involved in a research-based university really gave me the confidence to pursue what I wanted. It enabled me to feel like I could really apply what I learned to make a change and a difference in society.
South has definitely prepared me for the future. All the opportunities that I've had prepare me for, getting the job, but also, maintaining a strong work ethic.
With South offering over 200 different student organizations, you're bound to find your place. Whether it's athletics, cultural events or organizations, career-based organizations, or even academic groups, you're going to find your place here.
There are so many different locations on campus that you can grab something to eat in between classes or a drink from Starbucks when you're studying. As a freshman living on campus, it was very convenient. You're right next to the dining hall, you're right next to all your friends. I loved how all the residence halls were right next to each other, so you didn't have to go far to visit a friend.
Game day has such a vibrant, exciting energy to it. There's no way you're going to sit there and be quiet and think you're just going to have a calm time with your friends. You're going to get up there, you're going to scream. Everybody's screaming "Go Jags" on game day, walking around campus between classes. You can feel it in the students here.
Come see for yourself what South has to offer and become a Jag.